If you have an L4-5 or L5-S1 disc bulge and you're searching for real relief without making things worse, you're in the right place. Today, you'll have 5 gentle movements that are designed to ease your leg pain, help you move and walk normally again, and support healing so you can avoid surgery and finally start getting your life back. You won't need any equipment, you won't have to guess, and I'll walk you through each exercise step by step so you know exactly what to do and how to do them safely. These are the same exercises I've used with my patients who couldn't sit or stand without pain due to a lumbar disc bulge, and now they're moving better, living better, and staying out of the operating room. Let's get started. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I help people overcome disc bulges, sciatica, and chronic spinal issues without surgery or risky medications using specific chiropractic corrective care. This channel is for busy people dealing with pain who want real, practical strategies to relieve pain, restore mobility, and prevent future flare-ups. Subscribe now if you want expert tips, simple exercises, and proven solutions that'll help you move better, feel stronger, and stay pain-free. Before we get into the first exercise, here's why I chose these 5 specifically for a lumbar disc bulge. Every move in this routine is designed to do one thing: relieve pressure from the disc while helping the body heal in a safe, natural way. They're not generic stretches or random core exercises. These are targeted movements I use with patients who are dealing with real disc-related pain, sciatica, stiffness, difficulty walking, or fear of movement. Now, I've placed them in a specific order, so it's important to watch them all the way through and do them in sequence. The order matters. We start with activation, then move to gentle extension, and then decompression. This builds stability and relief with every step. If you do this consistently, even just once a day, you can start to feel changes in how you move, how long you can sit or stand, and how much nerve pain you feel during your daily life. And as I go through each movement, I'll tell you exactly how many reps and how long to hold it so you know what to do and how to do it confidently. Make sure you stick around until the end. The 5th exercise in this sequence is one of the most effective ways I've seen to instantly reduce pressure on an injured disc and give your lower back the relief it's been craving. Let's get into number 1. We're starting with supine pelvic tilts because this movement gently activates your deep core and begins to bring motion back into the lower spine without any strain. It's one of the safest ways to reconnect with your lumbar spine when you're dealing with a disc bulge L4-5 or L5-S1. To begin, lay on your back with your knees bent and feet flat on the floor, about hip width apart. Keep your arms relaxed at your sides. Take a deep breath in, and as you exhale, slowly tilt your pelvis backwards so your lower spine flattens gently into the floor. You should feel your abdominal muscles engage slightly and your tailbone subtly tuck under. Hold that position for 3 seconds, then slowly return to the neutral starting position. This controlled tilting motion helps reduce stiffness in the spine, increases circulation around the disc, and begins to re-engage your stabilizer muscles without any compensation. Mechanically, this move introduces safe, unloaded flexion extension micro movements to the lumbar segments, which can reduce guarding and begin improving disc mobility over time. Aim to do 10 to 12 slow repetitions. If it feels good and you're comfortable, repeat the whole set twice, resting briefly between rounds. As you go, you may notice a sense of increased mobility or warmth in your lower back. That's a good sign that blood flow is improving and your spine is beginning to reset. Now that your spine is activated and supported, let's move into a position that gently starts decompressing the disc itself and encourages healing without force. Movement number 2 is next, and to get started, all you need to do is change your position from your back to your front. Next, we move into a gentle position called prone lumbar extension. This is one of the most effective passive positions for easing pressure on the lumbar discs, especially when they're bulging backwards towards a nerve. Start by laying face down on a comfortable, firm surface, such as a yoga mat or carpet. Place your arms at your sides or underneath your head for comfort. The key here is to allow your lower back and hips to fully relax. If this position already feels relieving, simply stay here and breathe deeply for 2 to 3 minutes. This position alone can start shifting the disc pressure forward, away from the nerves, and begin reducing pain or tingling in the legs. If you're comfortable after the first minute, gently prop yourself up onto your elbows, keeping your hips relaxed and in contact with the floor. This subtle lumbar extension helps recenter the disc, creating more space for the nerves and reducing inflammation and irritation around the affected area. Hold this position on your elbows for another 2 minutes while breathing slowly. You may notice pain in your legs begin to lessen or move upwards towards your lower back. This is a good sign. It means the disc pressure is centralizing and the irritation is calming down. If anything feels sharp, uncomfortable, or increases your pain, return to the flat position and continue to breathe deeply. This position sets the stage for more extension, and the next exercise will take what we've started here and build on it into a gentle motion to increase relief and stability. Let's move on to number 3. Now that your spine has been activated and gently decompressed, it's time to move into standing lumbar extensions. This movement helps reinforce the relief you created in the first 2 positions by applying gentle, controlled extension while upright. It's especially useful during the day after long periods of sitting, bending, or standing in a slouch position. To begin, stand upright with your feet shoulder-width apart. Place your hands on your lower back with your fingers pointing down and your thumbs wrapped around your sides. This hand placement will support your lumbar spine and guide your motion. From here, gently arch your lower back by leaning backwards over your hands. Keep your knees straight but not locked. You're not trying to bend far, just enough to feel a mild stretch in the front of your hips or light pressure on your lower back. Hold this extended position for 2 to 3 seconds, then return to a neutral standing position. Repeat this movement slowly and smoothly for a total of 10 reps. If it feels good, you can do up to 2 sets, especially after activities that irritate your back, such as sitting or driving. This movement helps restore the natural curve of your lower spine and encourages the disc material to move forward in a more neutral, less irritated position. It also helps interrupt the flexion-based postures that worsen disc symptoms. You may feel a sense of lightness, improved posture, or reduced tension in your lower back after. If you feel leg symptoms decrease or shift upward, that's another positive sign that disc pressure is being relieved. Next, we'll address a common problem that happens when a disc bulge presses more to one side. If your pain is stronger on one side than the other, the next movement may be one of the most important ones in this sequence. Let's go there now. It's called a standing lateral shift correction, and it can help reposition the disc material and relieve pressure off the affected nerve root. It's commonly used when symptoms are worse on one side of the body versus the other, such as sciatica running down only one leg. Stand next to a wall with your feet about shoulder-width apart. Position yourself so that the painful side is away from the wall and your pain-free side is closest to it. Place your elbow, forearm, and hip against the wall for light support. Your upper body should stay upright and square, not leaning or twisting. Now gently shift your hips towards the wall while keeping your shoulders and chest in place. Think of it like gliding your hips sideways rather than leaning into the wall. Move slowly into the side shift, then return to the starting position. Perform this motion for 10 to 15 reps. This movement works by guiding the disc material away from the nerves, reducing irritation and helping symptoms centralize. If your leg pain begins to lessen, move upward, or become more focused onto the lower back, that's a very good sign. It means the pressure on the nerve is decreasing. If the movement feels productive and you notice relief, you can repeat the sequence 2 or 3 times throughout the day. Always move gently and stop if it increases your symptoms. Now that we've addressed side-specific disc pressure, it's time to finish the routine with one of the most effective passive decompression positions you can do at home. Let's move on to the final movement. The final movement is one of the simplest and most effective ways to relieve pressure from an L4-5 or L5-S1 disc bulge. It's called the 90-90 decompression position, and it works by passively unloading the spine and allowing your lower back muscles and discs to relax and reset. To begin, lie on your back on the floor near a couch, ottoman, or sturdy chair. Carefully lift your legs and rest your calves onto the surface so that your hips and knees are bent at 90 degrees. Adjust your body so your thighs are vertical and your calves are fully supported. Your arms can rest on your sides, palms up. Once you're in position, take slow, deep breaths and allow your body to completely relax. Stay in this position for 5 to 10 minutes, letting gravity gently ease pressure in your lumbar spine. You may feel a sense of release in your lower back or notice that your legs feel less tense. Some people even describe it as a melting sensation of the spine. This position helps reduce disc pressure, calms muscle guarding, and promotes circulation around the injured area. It's especially helpful at the end of the day after long hours of sitting, standing, or walking. Over time, using this daily can retrain your spine to find relief in a neutral, supported position. If you can, make this the last thing you do before bed. It gives your spine a chance to recover and unwind without the pressure of weight bearing or movement. Now that you've gone through the full sequence, you have a complete disc-specific relief plan you can do daily. These exercises work best when done consistently. Even just once a day can create real progress in how you feel, how you move, and how your body heals. Surgery can be avoided in many lumbar disc bulge cases. I've seen it firsthand. When you give your body the right movements and avoid the wrong ones, you give it a real chance to heal. These exercises can provide relief from leg pain, restore mobility in the lower back, and reduce pressure that's been building around that injured disc. If you found relief with one of these moves, like and share this video. It might be exactly what someone needs to see today. Also, comment below and let me know which exercise gave you the most relief. Was it the prone lumbar extension or the standing lateral shift against the wall? And if you want to keep building your strength, healing naturally, and staying ahead of your pain, be sure to subscribe to my channel. Now, it's just as important to know which movements to avoid as it is to know which ones bring relief. So the next video you should watch is this one, 5 exercises that make lumbar disc bulges worse. Go watch that video next if you want to protect your progress, avoid setbacks, and keep your disc bulge recovery moving forward.